Good day, everyone. Thank you for being here today. My name is Melissa, and I will be presenting assignment 2 for the concept of nursing subject. In this presentation, I will be discussing three main areas: critical thinking in nursing, the legal implications related to negligence or malpractice, and the nurse's responsibilities in daily clinical practice. Let's begin with the objective of my presentation. This is my objective. Introduction to critical thinking. What are the legal implications for the nurse's action to establish elements of negligence and malpractice? And what potential legal consequences and applicable legal concepts may be involved? And what are the nurse's responsibilities in ensuring patient safety and in upholding ethical and legal standards in daily clinical practice? This is the introduction. What is critical thinking? Critical thinking is essential in nursing, particularly when addressing complex ethical issues and responsibilities. It involves rational evaluation, considering different perspectives, and making informed decisions to ensure patient safety and well-being. Through critical thinking, nurses apply ethical principles in autonomy, beneficence, non-maleficence, and justice to guide their actions, resolve conflicts, and uphold patients' rights. It also supports adherence to legal duties like proper documentation, informed consent, and confidentiality. In today's diverse society, critical thinking helps nurses identify biases and challenge outdated beliefs. As John Dewey noted, breaking away from mental ruts is challenging but necessary for reaching sound ethical decision. And this is the picture of John Dewey. Understanding legal implications in healthcare is essential for nurses, especially as negligent cases rise and the fear of lawsuits grows. The first nursing law, established in 1903, addressed nurse registration. Today, nurses are most familiar with tort law, which covers malpractice and negligence, common concerns in the field. Malpractice occurs when standards of care are not met and causing harm. To prevent legal issues, nurses must accurately and consistently document and report their care. Legal education is a key part of nursing training, and ongoing knowledge is necessary throughout a nurse's career. As legal challenges increase, hospitals often require nurses to have a strong legal understanding to ensure safe and lawful practice. In Malaysia, we have a code of professional conduct for nurses according to the Nursing Board Malaysia. What are the legal implications of the nurse's actions concerning negligence, malpractice, and potential legal consequences? In this presentation, I will analyze a clinical incident involving Miss Lina by exploring the legal and ethical implications related to nursing practice. Here is an overview of Miss Lina's clinical background. Miss Lina was admitted for diabetic foot ulcer. She has a known case of diabetes mellitus and she was admitted for wound management and monitoring. What are the clinical incidents happened to Miss Lina? Her blood sugar levels not regularly monitored due to nursing staff shortage. And Miss Lina also experienced hypoglycemia and loss of consciousness the next day. A nurse documented glucose level without conducting the test. I would like to emphasize a critical issues happens here, such as falsified documentation of patient records, failure to provide safe and timely care, breach of duty of care, and compromised patient safety. This case highlights the importance of nursing responsibilities, especially concerning patient safety, critical thinking, and adherence to ethical and legal standards. The nurse involved in this case may face the following legal implications. Number 1, possible negligence or malpractice. Number 2, violations of documentation standards. Number 3, legal accountability for falsifying records. And number 4, risk of disciplinary actions or license suspension. The ethical responsibilities demonstrated by the nurse in this case are as follows. Violation of the Nursing Code of Ethics, failure to uphold integrity and honesty, ignoring patient-centered care principles, and detriment to professional trust. Based on this case, here are some key reflections and possible improvement we can make. We must know the importance of accurate documentations, must have adequate staffing to ensure safe care, encourage reporting errors honestly, and promote ethical decision making and critical thinking. The nurse should know that regular blood glucose monitoring in diabetic patients is essential to maintain safe glucose levels, prevent complications like hypoglycemia or hyperglycemia, and to guide appropriate treatment decisions. In conclusion, this case highlights the serious consequences of clinical negligence. Nurses must maintain ethical integrity, ensure safe patient care, and adhere to legal standards. The nurse must have accountability, and transparency are essential in daily practice. What are the nurse's responsibilities in ensuring patient safety in upholding ethical and legal standards in daily clinical practice? Nurses ensure patient safety by providing competent, evidence-based care, identifying potential risks, and adhering to hospital protocols, ethical codes, and legal standards to prevent negligence and uphold professional accountability in daily clinical practice. Ethically, nurses are expected to uphold fundamental principles such as respect for patient autonomy, which means acknowledging the patient's right to make informed decisions about their care. This includes providing adequate information, supporting patient choices, and not imposing personal belief. Maintaining confidentiality is another essential ethical duty, ensuring that all patient information is kept private and only shared with authorized individuals directly involved in the patient care. Furthermore, nurses are required to practice with integrity, honesty, and compassion, treating all patients with dignity without discrimination, and showing empathy even in challenging or emotionally charged situations. Legally, nurses must be knowledgeable and compliant with regulations and laws that govern nursing practice. This includes understanding the importance of obtaining informed consent before procedures, accurately and thoroughly documenting care, and fulfilling mandatory reporting obligations such as reporting abuse and unsafe practices. They must also operate within their scope of practice, avoiding tasks for which they are not licensed or trained, as this could lead to legal consequences such as allegation of negligence or malpractice. Additionally, nurses have a responsibility to communicate effectively with patients and other healthcare professionals. This involves actively listening to patient concerns, explaining treatments and procedures clearly, and collaborating with doctors, pharmacists, and allied health staff to ensure continuity and safety of care. Effective communications promotes informed decision-making, reduces errors, and strengthens the therapeutic between nurse and patient relationship. In conclusion, the role of nurses in safeguarding patient safety and upholding ethical and legal standards is fundamental to quality healthcare delivery. By consistently applying clinical competence, ethical principles, and legal accountability, nurses contribute significantly to promoting safe, patient-centered, and professionally responsible care. Their responsibilities go beyond delivering care. They must also exercise sound judgment, maintain professional integrity, and navigate complex healthcare environments with competence and compassion. Ethical principles such as respecting patient autonomy, maintaining confidentiality, and promoting dignity are core to nursing practice, while legal responsibilities ensure that care is delivered within the boundaries of professional regulations and laws. Failing to uphold these standards may result in serious consequences, including patient harm, legal liability, and damage to professional reputation. Therefore, it is crucial for nurses to remain informed, vigilant, and proactive in their roles. This topic highlights the importance of continuous learning, reflective practice, and ethical sensitivity in a nurse's daily responsibilities. By doing so, nurses not only protect the well-being of their patients, but also strengthen public trust and contribute to a safer, more accountable healthcare system. Ultimately, integrating ethical and legal awareness into daily nursing care is not optional. It is a professional duty that defines the quality and safety of patients' outcomes. Thank you, and that's all of my presentations. Thanks again for listening.